Joining me now to help us understand this more, Dr. Vin Gupta, pulmonologist, global health policy expert, and affiliate assistant professor of health metrics sciences at the University of Washington. And, of course, a very familiar and reassuring face for all of us. So, Dr. Gupta, let's talk about the big picture here. This is the one study, but we do have the Delta variant spreading here in the United States. How should people be interpreting what we just heard from Raf?
Casey, good afternoon. What I would say is that this is in line with expectations, and this is what we've been saying from day one, that vaccines are intended to keep you away from the hospital. And that's exactly what we're seeing here. I'm hearing numbers of 93, 94% real-world effectiveness of the Pfizer vaccine, of the AstraZeneca vaccine, if you get both doses of AstraZeneca, at keeping you out of the hospital from the Delta variant. And, frankly, that's all that should matter. I'll also add the CDC came out recently, Casey, about 5 days ago, with evidence that even if you test positive for coronavirus after you're fully vaccinated, the chances you could transmit the virus to, say, an unvaccinated child at home is basically zero, unless you're, say, in the immunocompromised category. So there's some exceptions to that. But for all those parents out there wondering, well, am I at risk of passing on the virus if I'm out in the world unmasked but fully vaccinated? The chances you could do that are still extremely rare and almost zero, especially for immunocompromised.
Now, I'm glad that you brought that up, because I think that's really, for those of us who are vaccinated and who are able to get the vaccine, okay, how do I keep people around me safe? And there do seem to be some different concerns with the Delta variant and children. Can you help us understand why that might be or what's going on there?
I think what we know is in exceptional cases, Casey, coronavirus, but there is a worry that the Delta variant might cause more cases of children ending up in the hospital. We're seeing out of Indonesia, for example, Brazil, 1 in 8 cases are actually in children, and those are less than 18 years of age ending up in the hospital, in some cases actually requiring ICU level care. Is that because of the Delta variant? Well, we don't necessarily know that, but there is this worry that the longer this continues to spread, the longer we have young children unvaccinated, that we're playing potentially with a risky situation, because the Delta variant is more transmissible, more lethal, we think, across age groups. But again, just to reassure parents out there, the chances that you could pass on the virus to your children that are, say, less than 12 years of age, if you are fully vaccinated, is exceptionally low, especially if you are not immunocompromised. We don't have enough time to talk about what immunocompromised means, but that's recent cancer, say, on chemotherapy, high doses of steroids, if you have an immunocompromising condition, for example. In that case, and let me just plug here, there is now evidence suggesting if you are immunocompromised, that's about 4% of America, you may actually qualify for a third dose of the vaccine before long, because we really think you might need that third dose to be fully vaccinated.
Well, that's very interesting set of facts. And of course, I'm sure a lot of those people are also being particularly careful with masking as well, which hopefully also protects their kids. But thank you for underscoring that important point. I think it's a sigh of relief for those of us who do have small children running around who can't get the shot yet. Dr. Vin Gupta, thank you very much for being with us today. We really appreciate your time.